Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great day and a great start to your day. And we always appreciate you guys coming on with us, and we thank you very much. And let's say hello. If it's Brahim or Mike from Norland, they got a trick, guys. Yeah, there it is. There's Brahim, our dear friend from Portland, Oregon. Eric, you're number 2. Mike, you're number 3 this morning. Good morning to you 3, okay? I'm going to call you the Trinity. Carrie from Nebraska, good morning. John, Elaine from Newfoundland. And Yvonne, how are you? And Mary from Norwich, good morning. And Tina from Nova Scotia. Nick from our stop. Marlene, good morning. Heather from Miramichi. And Marcia from Mexico. Wendy from Markham. And right from Hamner is Yolande, bonjour. Lori, how are you? Maria from Ottawa. Janice from Brampton. Snow, what? Sandy from Chilliwack, British Columbia. Donna from Newfoundland. And Kelly from Ontario, London. Debbie from Sturgeon Falls. Rita says, I love question and answer Friday. So do I. Joanne, Judy, Massey, Newfoundland. Cecilia from Sudbury. And what is that? Frida, how are you? Yvonne, Petawawa. And Diane, and Judah, and Janet, Beamsville. Sandy, good morning from Washington State. Regina, nice to have you on. Maryland, Edmonton. Nellie, good morning. And Kevin, I missed you, Kevin. Kevin, I never want to miss you, buddy. Deborah from Timmins, hi, Deb. And Gertie, how are you? Fran, Orangeville. And I can hardly see it. Andrea, good morning to you. It gets up into my cloud up there. I can't see it. Nativity, Lise from Delhi. Samuel, how are you? And Linda, you know how much we love Linda's from New Brunswick. Kim, there she is, and she's in Florida. How are you, Kim? And Vince, how are you? Couple of more guys. Karen, Coldwater. And Lucretia, our Grace. Monique from Texas, good morning. And hello. And I just missed one there, but I couldn't see it. Couldn't see the name at least. Janice, Linda. Oh, those Lindas. Leo from Cochrane. And Wanda, good morning from Virginia. Wendy from Wasaga. Kathy from Brampton. And is that Kelly? And you see, I can't see it. Guys, might as well quit while I'm ahead. Ooh, it makes me upset when I can't see those names. Like I want to say hello to all those dear folks. Okay, let's get to the questions, guys. Question and answer Friday, always fun. Babita, my sister-in-law has floaters in her eyes. Why does she have them and what to do about them? Well, there's probably a couple of reasons, okay, that cause floaters. One of them is dehydration. I just don't know how many times I used to see that in my office. Dehydration, okay? And because the eye, there's circulation, and the fluid is really important. A lot of people, they don't realize, like I said, they don't have a light on top of their head that tells them they're dehydrated. I just used to see that so much in the office. You know, probably 80% of the patients that came in to see me over the years were dehydrated. They just didn't drink enough water. And they, doc, I'm not thirsty. Well, don't wait till you're thirsty. Drink water. Sweet spot, 2 liters. Your eyes need water. Your brain needs water. Your gut needs water. The best fiber in the world besides coffee is water. People, you know, your gut needs water. Your blood, you want it to be, you know, people can have a heart attack. Their blood is so thick. They're dehydrated. And the problem is, if you go on chronically over time, that can really affect your eyes. And one of the effects of that can be floaters. Now, the other one could be high blood pressure. You know, like you need to get that checked out. Okay, like if they just suddenly appear floaters, you need to get it checked out to make sure you don't have hypertension or whatever. That can be a factor because of the micro bleeding behind the eye with the pressure. Remember what I always say about eyes, okay? You look in an eye, you get a doctor, an ophthalmologist or whatever, even your family doctor, if they go in and look at your eye, they're really looking, the biggest thing they're seeing in the back of the eye is that circulation, okay? So when they see macular degeneration and all that, those are circulatory problems. It's blood vessels, okay? So that's really, really important to check. And then the third thing that can cause floaters, babita, is medication. There are certain medications that can cause floaters. I remember patients that were on Xanax, anti-anxiety medication. What was the other one I used to see in the office? It's just slipping my mind. But anyways, there were certain meds that could cause floaters too. So again, you need to, if what your sister ought to do or sister-in-law ought to do, Babita, make sure she gets that checked out. Never take that lightly. Any change in the eyes, don't take that lightly. Dale, how are you? Does DHA break your fast? Well, look, I like the question, Dale, because you have to, look, if you have a coffee with cream, okay? Now, I like my coffee black, okay? So when you're fasting and you're doing intermittent fasting and you take your supplements in the morning, okay, which I do, and a lot of times I'm intermittent fasting, meaning I'm going to go till 10 o'clock or even noon without eating, okay? I don't always do it, but if I do it, technically, yes, DHA, because there's calories there in fish oil, but really, you are not affecting your fast at all, Dale. Really, okay? Because, again, what's the advantage of fasting? There's lots of them. On your digestion, on inflammation, on your blood sugars, your insulin resistance. I like fasting. Now, remember that the reset, the metabolic reset, eggs, meat, and cheese, is fasting without fasting. And the reason I say that is because when you are eating eggs, meat, and cheese, your pancreas, which is the biggest thing, look, when you're fasting, you're thinking pancreas, you're not secreting insulin, and you're thinking liver, you're helping to empty it. When you're eating the right foods, when you have an egg, are you fasting? No, but you're not using a lot of insulin. You're emptying your liver. So that's why the metabolic reset is so wonderful, because you get to eat and you're not secreting a lot of insulin. You're secreting some, a little wee bitty. But you know me, when you're on the reset, your pancreas is on a holiday in Hawaii. It's gone to Hawaii for 30 days. And again, the benefits of that are legion. They're legion. They're so good for you. And that's why I wrote the book, The Metabolic Reset. And then I put the reset again. You know what? By the way, we have a sale going on, 2.0, Black Friday. I don't even know about these things, but I found out last night. And you know what? You need to order. You want to get a good Christmas present? Okay, where is my book? Okay, you're going to get 15% off the book, Sun, Steak, and Steel. This bestseller is on sale. Okay? Now, why don't you order that and order copies for your friends, your neighbors, your family? And because in here, I mean, I talk about 8 critical blood tests that I like. I talk about, of course, Sun, Steak, and Steel, and sleep. I talk about the importance of drinking coffee in this book. And I put the metabolic reset. It's here, okay? So in the metabolic reset, what I did, okay, in the book, let me just show you what I did, okay? Chapter 8 is the reset, okay? And what I did is I answered questions that I get about the reset all the time. What is the reset, okay? How did the Martin Clinic come up with the eating plan? Okay? How and why? Why is this for everyone? It's for everyone. Because it's not, you're eating, when you change fuel, the big thing is changing fuels. When you get that, and what your body does with that, the anti-inflammatory effect of that is unreal. Okay? It's unreal. Now, good questions, right? Good questions. Okay? Now, let me continue on. I like that question, Dale, because they, it's really good, but I want you to understand where I'm coming from. I think that's really, really important, okay? Now, vertigo, besides physio, Louise. Well, look, I mean, they have the technique. Vertigo, okay, again, it could be viral, okay? Like that's one of the things that is the cause of vertigo. Comes out of nowhere. Could be virus, okay? And me, I love getting your vitamin D levels up, okay? Getting your vitamin A levels up, eggs, meat, and cheese, okay? I'm big on that because those fat-soluble vitamins, vitamin D and vitamin A, are huge, huge contributors to fighting the virus because a lot of vertigo is viral. Comes out of nowhere. Boom. Okay? Now, you always try the technique, okay, of, the flipping, trying to get the crystals in the middle ear to be balanced again. And that's what you were saying with physio. Yeah, there's different people that do that technique. Certainly worth a try. And like I said, supplement-wise, I'm big on vitamin D and vitamin A. Okay, thanks, Louise, for the question. Sue, if my husband is following your advice, well, he's a smart man. Okay. Sue, you can tell him that. Should my husband be under the care of his physician and do blood work? Yeah, for sure. I never tell anyone not to be under the care of their physician. I am trying, what I do with people, okay, I'm trying to educate people. My job today is education. I'm not in practice anymore. I don't see patients anymore, okay? What I try and do is give you my experience, and helping people because when you go to your doctor, okay, you want to be armed. I think a patient, I used to tell patients, I used to give them a report. If they left my office, I gave them a plan, and it was always a plan to succeed, never to fail. Okay? I always give my patients Number one, an eating plan. Okay? Here's a plan. Here's what you're going to do. And I would always discuss their biomarkers with them. Okay? And what I want you to do is when you go to your doctor, okay, and you should, know what blood test to ask for if they don't do it generally. Okay? Because, look, if it's almost like I've talked about this in the past. There's a commercial on TV, or commercials. In the United States, you don't see them so much in Canada, but of course, you watch American TV in Canada and, whatever. All I'm telling you is there's a lot of commercials for pharmaceuticals. There's a lot of commercial for drugs. And you know what they do? They're not stupid. These marketing people with big pharma are not stupid at all. Here's what they do. Ask your doctor if this drug is good for me. And you know what they're really saying is if you don't ask, you don't get. Now, I always kind of chuckle with those commercials because I go, as if your doctor doesn't know what medication to give you. But marketing people are very smart, and they go, if you go in and ask your doctor, would this drug be helpful to me? Guys, what I want you to do is when you go see your doctor, okay, or your healthcare practitioner, I want you to ask them, here's the test I would like you to do. Ask your doctor if these tests are good. Now, it's because if you don't ask, especially with blood work, they don't know. Look, they'll do a general CBC and this kind of thing. I get that. But I'm very, very specific on biomarkers. And is it Sue? Wait a minute. Okay. Sue. How do you know if any issues or something does not work? Well, you see, that's the point. The point of all of this is you are looking at very specific things when it comes to metabolic syndrome, which 93% of the population have. I'm really interested in, you should be very interested in those biomarkers, and you want to get them tested, okay? You want your doctor to test them. That's why do you think I'm so big on it? I want your doctor to test vitamin D. Now, you might have to pull their teeth. You might have to bring them to the dentist and have their teeth drilled without anesthetic to get them to do a vitamin D. I don't know why, except that, again, they just don't understand the significance of vitamin D. They should, but they don't get taught. So you know better. So what you do, insist. I insist you take my vitamin D at least once a year or twice a year. Now, I got a question asked about that, so let me answer, okay? I got another question the other day about vitamin D and B12. Should I stop taking the supplement before I get my test done? No, absolutely not. I'll tell you why. Because it's not going to change overnight. Your vitamin D serum levels don't change overnight. Okay? And so whenever you get a vitamin D done and B12, I'm big on those two. Get your vitamin D done and B12. Those are critical tests to get done. But if you don't ask, a lot of times they're not even looking at B12. I've taught you in the past that B12 used to be very significant to most physicians in the 1950s and the 1940s or whatever. 1960s, less. But every physician was giving patients B12 in those days. I mean, any physician. But today, meh. And it's important to understand the ranges of the blood test. This is why, get the book. Just that, those 8 critical tests that are in this book in chapter, what chapter is it? I can't even remember now. Is it chapter 9? No, chapter 9 is my Proverbs. Let's see if it's chapter 10. Yes, it's chapter 10. Okay, 8 critical blood tests ask your doctor for. Okay, so that's a commercial. And it's for you because I want you to know what tests to ask for. It'll give you a complete look at how your body's doing. One of them is CRP, because I think we got a question this morning. Okay, so Sue, I answered your question properly? Okay, let me get another one here. I think someone was asking me about, oh, for heaven, I lost it some. Oh, yes, Melissa. Thank you, Melissa, for this question. How long does it take to lower CRP? Well, that depends. If you have an autoimmune disease, it's going to take you longer to lower your CRP. And you might never get it to completely normal, but you can lower it, okay? CRP is C-reactive protein. It's a test. It's an essential. It's in my 8 critical tests. Ask your doctor for the CRP test to be done. Why do you need that? Oh, I get a headache. Somebody asked me, I'll answer this in a minute. What about idiopathic intracranial brain hypertension? Doc, what about idiopathic intracranial hypertension? That's what I get when I get intracranial hypertension. And I'll answer that in a minute. But when you ask your doctor for the CRP test, a lot of them resist that test. It's because they don't see inflammation as being a big problem. You got inflammation. Who cares? Right? I have inflammation. I have pain. But what we're talking about, CRP, is silent inflammation. Okay? For the last 40 years, I've been talking about inflammation. Not the kind that you get, it's the inflammation without injury or inflammation without infection. That is a silent killer because that inflammation can destroy your tissue, your endothelial levels of your blood vessels. This is why you need to go and ask your doctor for the CRP test. It is an accurate test of silent inflammation. Now, if you have an infection, that can throw your CRP off. If you have an injury, that can throw your CRP off, okay? Because it measures inflammation. But understand that. You got it? Ask your doctor. I want you to go ask your doctor. And look, bring a pen and a notepad when you go to your doctor. Have your questions ready. Okay? Used to bother me. You go to a walk-in clinic or whatever, okay? And they said, you get one question. Oh, I got intracranial hypertension. When I hear that, you get to ask only one question. You know what I used to encourage? Ask questions. Bring your notepad. I'm going to give you, okay? Ask my staff. I'm going to give you a report of all your findings. Plus, underneath, you're going to be told what these mean. And then I said this, and everyone heard this on the way out. If you have any questions about the report I gave you, anytime, ask questions. Guys, you've got to learn that. How do you think you learn anything? Ask questions. Okay? Ask questions. Okay, thank you, Sue. Okay? Did I answer your question? Melissa, did I answer your question? Okay, Susan. Does issues with the parathyroid affect your actual thyroid and the conversion and give your thyroid symptoms? No, not, well, I guess it's possible. You could get inflammation of the parathyroid that could affect your thyroid, but not really. How do they test, by the way, because you're asking the question, Susan, how do they test your parathyroid? They will do a calcium test, because your parathyroid regulates the amount of calcium, okay? Not in your bones, but in your blood, okay? You got calcium in your blood, but you don't want too much, okay? Now, we know one thing, that vitamin D helps with your bones. Why do we put vitamin K2 with vitamin D? Because K2 brings calcium and puts it where it belongs. It takes it out of the bloodstream and puts it, calcium, where it belongs, in your bones. Okay? That's really significant. Okay? It decalcifies. Calcium's good if it's in the right place, guys. You don't want a calcium in your blood vessels, clogging up your blood vessels, okay, and hardening your arteries. That's why vitamin K2. And listen to what God does, okay? I'm going to toot God's horn for a minute, okay? When you have cheese, what do you get? Calcium. Everybody knows that. You learn that when you're a kid. Oh, I get calcium when I eat cheese. But isn't it interesting that God gave or put vitamin K2 in with calcium in your cheese? Butter too. Meat too. Isn't it interesting that vitamin K2 is in the animal kingdom? I read the other day, someone was commenting to me, "Oh, Dr. Martin, we were never meant to eat animal products." I said, okay, I beg to disagree with you. First of all, your anatomy, okay, including your stomach and your teeth, and the enzymes that you have, and the pH that you should have in your stomach was meant for meat, and specifically red meat. Okay? How could you get B12 without it? And in the animal kingdom, eggs, meat, and cheese, you have all your vitamins, all your minerals, okay? Plus vitamin K2, which isn't in the plant kingdom. In the plant kingdom, and I didn't say it was no good, okay? I didn't say you couldn't have any fruits and vegetables. I'm not saying that. What I am saying is, listen, Linda, and listen, Larry. Vitamin K2 is not found in the plant kingdom. It's only found in the animal kingdom. Now, what should you be eating? Got it? Okay. I tooted God's horn. Because in nature, that's what you see. Okay? Somebody asked me a good question too. Let me get to it because I'm on the topic. Oh, Ann, would you ever recommend a carnivore diet? Well, yeah. Now, carnivore, like there's different forms of carnivore diet, okay? The metabolic reset is a ketogenic diet. The overall principle is you're changing fuels. It's ketogenic. I don't like the word keto in a way because the world took keto and they twisted it. Okay, they did. You have to understand, you go back you go back and the ketogenic diet was used. I remember reading when I was in school in the 1920s, not that I was in school in the 1920s, okay? But as early as the 1920s, they were giving the ketogenic diet, okay, no carbs, to who? Epileptic patients. And they got great results. Of course, that gets poo-pooed. Because the cereal companies and the liars, pants on fires food industry, they changed that. They don't want that. They didn't, they want to change history. So, when you're eating eggs, meat, and cheese, I love dairy. I don't want you to ditch dairy. I talk about that all the time. It's important to have dairy in your life. Why do you think I have cheese? And I'll answer another question in a minute. Okay? I'll answer another one I saw. Okay? But, okay, let me just get to it now. Because when you are eating a ketogenic like diet, okay, a carnivore like diet, okay, Anne's asking the question, well, how are you going to get vitamin C? Okay, well, Anne, do you mean coffee? Now you got to understand where I'm coming from, so you understand this, okay? Vitamin C is ascorbic acid, okay? And everybody thinks, oh, vitamin C, I got to drink orange juice, or I got to have fruits, and I got to have vegetables, okay? And they contain vitamin C, the vast majority of them. True, okay? But vitamin C is overrated in this sense, okay? Vitamin C, okay, the real vitamin C is found in coffee. And the reason I say it, okay, I always use the story, and I know it's a long story. I'll make it as short as I can. When Jacques Cartier, okay, now I'm talking to you about Canadiana, Canada's history, okay? When you're in school in Canada, I don't even know if they teach it anymore, but they should. There was a fellow who came from France. His name was Jacques. Jacques Cartier, okay? And when he came from France, by the time he got into, it wasn't called Canada at the time, but he named it Canada. That's what we learned, that Jacques Cartier was the guy who named Canada, Canada, okay? Now, what happened? He lost 25 men coming across the ocean, and they died of scurvy, okay? Scurvy is a lack of vitamin C. Now, you know how they cured scurvy? The natives, the First Nations, befriended Jacques Cartier when he came down the St. Lawrence River, and they gave him and the men that didn't die a tea. It was made of, you know what they made it of? Pine bark. Now, does pine bark have any vitamin C? Probably a little trace of it. But they cured the scurvy. Not with oranges, not with grapes. They took a tea and put pine bark in it. Why do you think I love pine bark so much? Right? There was a fella by the name of Jacques Mascalier who actually read the story of Jacques Cartier, and he said, well, how could pine bark fix scurvy? It doesn't make any sense to me. He went back to France. He discovered pine bark, or at least he started researching, didn't discover it, but he researched it. And he found out that pine bark, it wasn't the vitamin C, it was the phytonutrients. So, and here's the answer to your question. When you have, when you eat carnivore, you call it carnivore, I call it eggs, meat, and cheese, although some carnivore, they just eat meat. Okay? You want to do that? Go for it. But I like eggs, meat, and cheese. There's reasons I want people to eat eggs. There's reasons I want people to have dairy. Not milk, unless you have a cow in the backyard. There's reasons. But here's the reason I want you to drink coffee. Okay? The same reason that Jacques Cartier and his men, and they wrote, we never felt better. We had the tea with pine bark. But do you know that coffee has vitamin C in it? It has a little trace of it. But you don't need a lot of it. Vitamin C, what have I always told you? Vitamin C is overrated. And you know what? This is a fact. When you eat nothing but carbs, you know, people, oh, I'm a vegetarian, Dr. Mark. Well, usually when I talk to vegetarians, most, not all, they are carboholics is what they are. I'm a vegan. You're a carboholic is what you are. You're living, now you're going to be very low in vitamin C. But it's amazing when you eat eggs, meat, and cheese, you're never going to get scurvy, especially if you drink coffee. I discovered 50 years ago the importance of coffee. Not only do I like it, it is the best thing for you. Isn't it wonderful that we have such a treat in coffee? You get a treat. I feel like every day giving people high fives because I get to drink coffee. Isn't it wonderful? And it's so good for you. And I've been saying it for 50 years. When people, coffee, Dr. Martin, is acidic. Coffee is full of caffeine. It's gonna kill you. And I said, no, it won't. It's the opposite. And I got over 150 studies, over 150. As a matter of fact, there's more than that shows the importance of drinking coffee. Now, if you're a tea drinker, I feel sorry for you. No, you can have tea. But it's not as good as coffee. Okay, I am going too long on these questions. Angela, okay? Denise, I better not go past you because Denise says, my granddaughter was diagnosed with idiopathic intracranial hypertension. You know, that is in the cranium, your head, the pressure is going up the spinal fluid. Intracranial fluid is going up and you get pressure. What could cause that? Well, there's a few things. Okay? There's a few things. One of them is dehydration. I always come back to that. What? You got more fluid. Yeah, but you're dehydrated. Your body's making more. It's trying to compensate. 1. 2. Okay? 2. Hormones. Not hormones. Hormones. Why does idiopathic, cerebral, intracranial, oh, don't you just love medicine and their big words? Hypertension, why does it happen mostly in women and not men? Why? Because women have hormones. Okay? Hormones. That's a big thing. Too much estrogen. Not enough progesterone. It affects that. Okay? That can be a big reason. And even obesity can cause that. And it's usually because of, that can mess up your hormones. Our hormones make you obese, and obesity can give you intracranial hypertension. Okay? hormones. Okay, that was the question from Denise. Angela, my question is, Dr. Martin says to change dairy, not to eliminate it. Yeah, switch it. Don't ditch it. How do you like that for a saying? Okay? Because of pasteurization and homogenization of the milk. Yeah. I'm wondering how other dairy products, heavy cream, butter, that are made from this milk are not to cause the issue. Well, sometimes they do. Some people, I know, they can't have cheese. Most people, they say they're intolerant to dairy, but they're really not. Remember what I told you. It's not so much the dairy, even though it's changed, it's you. Look, there's no way you're going to, don't hold your breath. We did a whole show on this the other day. Don't hold your breath waiting for the world to stop pasteurizing. It's not going to happen. Not going to happen in my lifetime. It's probably not going to happen in your lifetime. It's just not going to happen. Because I talked to you the other day about the two theories of disease. You have, and I was saying his name. Imagine me forgetting that his name was Antoine Béchamp. Okay? Antoine, Tony, Anthony, me. He had the same first name as me in French, Antoine. And don't call me Antoine, I don't like it. I want Tony. Okay? In school, the nuns, Antoine, don't you call me that. I didn't like that. I don't even like Anthony very much, even though that's my name. Okay? But there was Antoine Béchamp. Okay? And there was Louis Pasteur. Go back and listen to the podcast because it's a fascinating podcast. Louis Pasteur and pasteurization. Where do you think it came from? His name. Killed the bacteria. Antoine, Tony Béchamp, was a very smart man, and he said, why don't we worry more about the terrain, about the host? Worry about your immune system on the inside. Because you'll always have bacteria and whatever. Smart man. And I'm not. Louis Pasteur was a smart guy too, okay? It's just that they went hook, line, and sinker with Pasteur. The world went hook, line, and sinker. And today, you don't even know the name. I forgot his first name. Antoine Béchamp. Okay? I forgot his first name. Imagine that. But I knew those two theories. And, you know, you're not, Angela, you're not going to get away from pasteurization. It's here to stay. Okay? Now, if you make your own cheese and you got your own cow and all this and that, that's wonderful. But, you know, 99.9% of the population, they can't get no satisfaction. And they tried. No, I better not say. Anyway, all I'm saying is, look, you live in the real world. Things are pasteurized. They're still good for you. Okay? They're still good for you. I don't like milk at the grocery store because they took all the stinking fat out of it. Okay, good question. Tina, methylation, good or bad? What is it? Nah, look, I've been reading methylation. I can't handle it. It's so overrated. Oh, 25% have the methyl gene. You know, like I said, no, I don't buy that whatsoever. Like, it just doesn't come into my thinking at all. And, you know, you better have a methyl type of... look, the only good thing about methylation is B12. Because if you take B12... Wait a minute. I thought I had a B12 in front of me. I forget. I don't have it in front of me. Get the best B12, and that'll get rid of anything in methylation. You get methyl Cobalamin. That's the B12 you should be taking. It's the best. It's the one your body absorbs. It's the one in nature. Okay? Methyl. Okay. Thanks for the question, Tina. And a couple more real fast, okay? I did... Melissa, you're my Bonmian gland dysfunction. What are you talking about? I got to look it up. I mean it. What is it? I never heard of it. In all my years, I never heard of that. But Melissa, I will look it up and answer your question. I don't know what you're asking. My Bohmian gland dysfunction. Somebody answer her if you know what that is. I really don't know what it is. There must be another name for it. Anna, what did Dr. Martin think about melatonin? I love melatonin. I just don't like it as a supplement. Okay? I love melatonin. Your body makes melatonin. And she's asking about melatonin for cancer. I don't know about that, but you make melatonin in the sun. And when the sun's out, it's one thing you don't even have to sunbathe to get melatonin. Just go out on a sunny day and take your sunglasses off. Don't look directly in the sun. You don't have to. It's just bright. Isn't it wonderful? And you get melatonin. And when it's dark at night, your body produces melatonin. Well, that's why I want you to wear a mask. Not to cover this, but to cover your eyes. Okay? Thanks for the question. Tina, how do you fix gallstones? What causes them? You don't use your gallbladder. That's how you get gallstones. Now look, some women get gallstones because of estrogen dominance. You see, progesterone is always the antidote to estrogen. And progesterone, pro-baby. Okay? A lot of women get trouble with their gallbladder after a baby. Why? All the progesterone is left in the placenta. And the body will go into gear and make it, but for some, it doesn't make it fast enough. They have estrogen dominance. And progesterone, by the way, is really important in smooth muscle. That's why women's bladder descends up. Okay? A lot of women's bladders, as they get older, sink like the Titanic. They come down. Okay? That is a lack of progesterone. Okay? It's really important to know that. I'm big on progesterone. I love progesterone. I love elevating progesterone. Okay? And I don't worry about estrogen, because there's enough estrogen around the world for 10 worlds. With all the xenoestrogens and all the... That's why women have so much trouble, okay? And the other two, number two. So number one is hormones. And the second reason that women mostly get gallbladder problems, more than men, by the way, is because they're eating chicken and salad and not eating red meat because they think salad is better than chicken. Salad is better than meat. No, it's not. And you need a gallbladder. It's a storage center for bile, and bile is made in your liver, and that is stored in your gallbladder, and it's to emulsify fat. And, oh, Dr. Martin, you know how many times I heard this, especially in the 1980s, the 1990s, and the early 2020s? I'm on a fat-free diet. I said, yeah, and that's why you got no more brain in your head. Plus, that's the reason you got a gallbladder problem. You're not eating enough fat. Why do you think God gave you a gallbladder? Okay, I'm sorry about that. I get excited. Okay, two more. Sheila, ataxic gait. What can you tell me? I've been supplementing with shots. I don't know what you're talking about. Like supplementing with shots and pills for 6 months with no change. I don't know. You got Sheila, like you got to give me more information than that. And attacks at gait, it could be. Do you have Parkinson's? Do you have you have obviously some kind of neurological problem. But you got to give me more detail and tell me what supplementing with shots, what kind of shots, like a B12 shot or, okay? I need to know that, okay? Give me more detail, Sheila, thank you. And I'll answer your question more specifically. Last one, Dorothy, who I am 82. Well, good for you. Good for you, Dorothy. You're 82. And I've started to hurt when I walk. What took you so long? You got away with it for 82 years without having any sore feet. Now your feet are sore. Yeah, it happens, my dear. Happens. Okay? And really make sure, you might never needed to before, but make sure you got real good walking shoes. And you might, I don't know, I need more detail. You might have some condition called, are you a diabetic? You might have some neuropathy. You might be low in B12. All those things need to be checked with sore feet. Okay? Okay, guys. Way over time. Thank you for all these questions. We love it. Now remember, okay? Right at the top of the program, what did we say? Okay? This is for educational purposes. Okay? Individual, like I said, I love when you go to your doctor and ask. Okay? And ask. And be armed. Be smart. Bring a pencil and paper. Ask your questions. Ask. And you shall receive. Seek, and you shall find. And knock, and the door shall be opened up to you. Okay? Guys, we love you. Talk to you soon.